How do myoclonic seizures relate to generalized epilepsy? Imagine a sudden, quick muscle jerk that happens out of nowhere, often involving the upper body or even the entire body. That's a myoclonic seizure, a brief shock-like movement that can come in clusters. These seizures are closely linked to a group of epilepsy conditions known as generalized epilepsy because they originate from abnormal electrical activity that involves both sides of the brain at the same time. This widespread brain activity is what makes the seizures generalized rather than localized to one small area. In many cases, myoclonic seizures are a key feature of certain generalized epilepsy syndromes. The most common one is juvenile myoclonic epilepsy, which usually starts in teenagers or young adults. People with juvenile myoclonic epilepsy often experience bilateral symmetrical jerks shortly after waking up. These seizures might happen along with other types of generalized seizures, like tonic-clonic seizures, where the body stiffens and then convulses, or absence seizures, which are brief lapses in awareness. Myoclonic seizures aren't limited to juvenile myoclonic epilepsy. They also appear in progressive myoclonic epilepsies, a rare group of disorders that tend to worsen over time. These include conditions like Unverricht-Lundborg disease and Lafora disease. In these cases, the myoclonic seizures can be more severe and persistent, often accompanied by cognitive decline and problems with coordination or balance. The neurological deterioration in these syndromes makes managing seizures more complex. When doctors look at brain activity with an electroencephalogram, or EEG, they often see characteristic patterns in people with generalized epilepsy and myoclonic seizures. These patterns include generalized spike wave or polyspike wave discharges, which show that the abnormal electrical activity is happening across the entire brain. These EEG findings help doctors distinguish generalized seizures from focal seizures, which start in just one part of the brain. Understanding how myoclonic seizures fit into the bigger picture of generalized epilepsy is important for diagnosis and treatment. Because they are a hallmark of certain syndromes, recognizing these quick muscle jerks can lead to a correct diagnosis. Treatment usually involves specific anti-seizure medications like valproate, levetiracetam, or lamotrigine, which are often effective. However, because each person's situation is unique, a healthcare professional's evaluation is essential to tailor the best approach. If you or someone you know experiences sudden muscle jerks, especially if they happen repeatedly or with other seizure types, it's important to seek medical advice. Proper diagnosis and management can improve quality of life and help prevent complications. Remember, epilepsy is a complex condition with many variations, so personalized care and ongoing medical support are key. Always consult a healthcare professional for an accurate diagnosis and appropriate treatment options.